Hi, this is Dr. Eric Westman, and today's Adapt Live is on keto and thyroid disease, thyroid medication, and I'll get to that in just a moment. I want to update you on the latest Adapt events. We were just in Chicago and St. Paul, and this weekend we'll be in Terre Haute, Indiana. So I hope to see you at a Adapt event in the Midwest in Indiana this weekend. Just to recap, there were 130 or so people in Chicago on the Loyola campus for the Adapt event 2 weeks ago, and then this last weekend in St. Paul there were about 200 people who gathered on a Saturday to talk about keto. And just to give you an idea of these events, I'll look at the people there and say, how many of you are doing a keto diet? And all the hands go up. And everyone wants to put their hands down. I said, no, keep your hands up. And I'll say, how many of you have been doing a keto diet more than 6 months? And just about every hand stays up. And I'll then say, keep your hands up. A few hands drop. But how many of you have been doing it for more than a year? A few hands start dropping. A year and a half, a few hands. And then 2 years. So have you been doing a keto diet for 2 years or more? Most of the hands drop. And then, I'll say 5 years, 10 years, 20 years, and my hand's still up there. Still, unless Jackie Everstein's in the room with me, I'm the one who's been on it the longest time, and just want to show that it's possible to do it. But please join us in an Adapt event. We had a great time the last 2 weekends, and we'll be in Terre Haute, Indiana this weekend. Again, the purpose of the Adapt events is to bring people locally together, the experts who are local, people who are following the diet who are local. In this last 2 weekends, I saw doctors get new patients because the patients want to find keto-friendly doctors, and these events are a way to bring the people together. So back to the topic at hand, keto and thyroid. The first thing I have to mention is that if someone comes to me in an obesity medicine or keto medicine practice, I have a certain protocol that I go through. I will spend typically a half hour or 45 minutes with someone to talk about their history in terms of diet and weight and other things that have to do with their medical problems, because the change in lifestyle can have a favorable impact on all of these things. So I'll also, if there hasn't been a thyroid blood check in the last 6 to 12 months, or maybe a year is okay, but if someone has never had their thyroid level checked, I'll check it. And the important thing about that, and as a first pass on keto and thyroid, is that I know that the people coming to my clinic have normal thyroids because I've checked it, or they've had it checked recently. So if things aren't working for you, you don't know why, and you've never had a thyroid level checked, that's the first thing that comes to mind. Because the thyroid is the major metabolic rate regulator, meaning it sets the idle speed of your body or the idle speed of your car, for example. So if your idle speed is really low in your car, you don't burn much fuel. In fact, you conserve fuel. Most people think of that as lowering your speed to conserve the fuel, but that's not what we want to do when we're trying to lose weight. So a low thyroid level is kind of like having a low idle speed where you're just not going to burn much energy, or you're going to gain weight even though you're eating a similar way that you've eaten for a long time. So assuming that you've had a normal thyroid level or you've had it checked, and keep that in mind. If you've never had it checked, things aren't working the way you think they should be, have your doctor check this. You can even get it done at anylabtest.com or these new places that have propped up in retail malls. You want to know that the thyroid level is in the normal or optimal range. Now, if you've been doing keto and you have normal thyroid, I really rarely, I can't think of one time when I've repeated the thyroid and it has become abnormal. So I'm not aware of that happening. And in fact, it's kind of a neutral issue. I don't really see the thyroid adjustment as a factor when people are on medication. I just keep the medication the same. Now, if someone's losing weight, then you want to reconsider all of the medications and the doses that they're on. And so I have seen a repeated thyroid level just when someone is losing weight on a keto diet and the adjustment has to be made either up or down. I've seen it both ways, so that weight loss can make you have a need to have an adjustment in the thyroid level if you're already taking thyroid medication. I've borrowed a lot of information and teaching from the obesity medicine world, not the straight endocrinology world, and there's a whole another set of teaching where we don't just consider the blood level when we're thinking about the thyroid. We think about how you're feeling and the symptoms. So as a general principle in obesity medicine, it's not just keto medicine or on a keto diet. If you have the symptoms of low thyroid, and you can do these symptom checklists online, they're easy to find, have your doctor check the thyroid levels, but also consider the fact that you might have best thyroid regulation when you're not in the so-called normal range. And that may be difficult for your doctor to wrap his or her head around. There are enough obesity medicine doctors and thyroid medicine adjustment doctors. These are also the doctors who are comfortable in using things like Armour Thyroid or Cytomel or something other than the levothyroxine that the straight endocrinologists seem to just adore and don't want to go beyond. When I've asked my endocrinology colleagues about that, they say that the other drugs just aren't as consistent, so that they want to use Synthroid because the consistency of the manufacturing. But you have to understand that Synthroid is only T4, not T3 and T4, and these other formulations have a combination of the two. So again, this really doesn't have anything to do with keto per se, but just in general, I think proper management of the thyroid includes not only the blood test, but also a symptom review of how someone is feeling. It reminds me of the history of thyroid management in checking for thyroid disease. Actually, before the lab tests were checked, doctors measured the temperature, first temperature in the morning, called the basal temperature. And so if I'm really trying to troubleshoot the lab values in the blood, don't tell me, you look at the advanced level of the free T3, the reverse T3, even thyroid antibodies. Sometimes the morning temperature can be useful and you can see the tables online, what to compare it to. If your body temperature is really, really low in the morning and you feel tired, you have all the symptoms of thyroid disease, I'll consider a trial of thyroid product, either the Synthroid or one of these other ones, to see if that improves how you feel. So thyroid is a kind of general thing. If you're otherwise healthy, I don't really see much change if you do a keto diet. Although I do have to admit, we don't have large-scale clinical trials measuring thyroid in all of these folks to see if there are even small changes. So that means you have to take matters into your own hands and have your own thyroid levels checked, and hopefully you'll be with a doctor who's willing to think through the different options, including talking about symptoms even when the blood test is normal. I just want to mention again the upcoming Indiana ADAPT event in Terre Haute. I think there's still some seats left. We were totally sold out in St. Paul, Minnesota last weekend. It was a great time. We had 3 fantastic doctors locally, a couple of case studies. Katie Newman, who put on the event, gave her first talk ever, and she did great. These will all be posted at the Adapt Your Life YouTube channel. So please come out. Again, the ADAPT events, the idea is to connect people locally, the local experts and local community members who are doing a keto diet. I saw doctors get new patients and patients get new doctors because they didn't know that there were these keto-friendly doctors in their area. So again, we went through Chicago, St. Paul, and Terre Haute here in July. And in the fall, in October, we'll take an ADAPT event tour of the South through Phoenix, Scottsdale. Dr. Adam Nally will be there. We'll be in San Antonio. Ask Nurse Cindy. Cindy is helping out with that and the San Antonio support group there. And then also the Roxborough, Durham, Raleigh event. We had 350 people in Durham, or Roxborough really, last fall, who again, raise your hand if you're doing a keto diet and all the hands go up. So we're looking forward to October with these ADAPT events as well. I hope that's helpful. And if you haven't had thyroid levels checked and you're doing this, get them checked if you think there might be an issue there. Remember, all of my patients have had them checked ahead of time, so I know that that's not something I need to worry about. If you hear me talking about side effects and things like that, I've seen people in an obesity medicine practice where I've made sure we've checked things up front that have been normal or within the normal range, or treated if there is an abnormality. But the keto's done so much for so many people, and ADAPT Your Life is a way to get really clean, keto-friendly products. I was just introduced to some brand new bars which are just totally amazing, and we'll talk about that at some other time. Again, this is Dr. Eric Westman with ADAPT Your Life. I hope to see you in Terre Haute this weekend, or in the Southern Tour of ADAPT events in October. Bye now.